When I started researching the school, I realized it was actually nationally known for a lot of the programs that they offer here. The law school, the doctorate of physical therapy program, and the MBA all rank in the top polls of all the national things. And so looking at Elon for a new program for physician assistant studies, I knew that there was going to be success in it from day one.
The program has a first year, which is a didactic year, and a second year, which is a clinical year.
And so you're learning a lot of medicine within that 12 months.
All of our students come in with anatomy and physiology as a prerequisite, human anatomy and physiology. I reteach their physiology component in about 3 weeks. So I'm teaching them what they should already know, but I'm giving it a whole different slant. When you're in a clinical setting, this is how you think about physiology. This is how you think about what will happen to a patient.
Hands-on learning is huge for our program. I think most of the health professions, hands-on learning is just a big part of it. You just can't get all this knowledge in books. Knowing what to do with it and how to apply it is the really big part of what we do here.
Your job in an anatomy lab is to have your hands on. It must be a hands-on experience. You can hand somebody a dissection manual and say, here, do these things. But there are a lot of other things you can do. Everyone who is enrolled in the PA program has declared, just with their enrollment, their intent to be a clinician. So as many clinical correlations as I can bring into the lab, I do. I bring them in over and over.
One of the things our teachers try to make sure that we're doing is approaching all the different learning styles. So whether you are a visual learner and you're reading it in a textbook, an auditory and you're getting it in lecture, or if it is a lab setting and you're a kinesthetic learner.
And being able to take that information and relate it to a patient in a fashion that the patient can use it to make decisions or to follow the treatment plan or to be engaged in their own treatment process is something that I want to try to relate to the students as well. So having them learn in an engaged fashion will help them then to teach their patients in an engaged fashion also.
In the atmosphere that Elon fosters, it's non-threatening. I think a lot of people are very afraid to speak up because they might be making a mistake, but this is such a wonderfully warm and non-threatening environment. And the students that are attracted to this place are people who want to, if they're going to be wrong, they'd rather be wrong here. And they are going to ask questions. They're going to take ownership of their own education. So they've really, really enjoyed all of those things.